Now coming to this aerosol generating procedures. What do you mean by the term aerosol generating procedure? What is an aerosol generating procedure? Aerosol generating procedures are described or defined as medical and patient care procedures that result in the production of airborne transmission of infection that may otherwise only be transmissible by the droplet route. That's very, very important. Okay. So this is how, as you see, when you're intubating, when you're back mask ventilating, you can see a lot of aerosols being generated. And these aerosols automatically, it can go through your nose, etc. It can go into your upper respiratory tract, and it can produce infections in you if you do not take care appropriately with necessary precautions. So how do I prepare for a procedure of intubation? There has to be an institutional preparation. It is not enough that you yourself are prepared. You must have an institutional preparation. An equipment for routine and difficult airways should be there. Trained personnel should be there. And PPE should also be available. That is also very important. Okay, PPE. We'll come to that one by one. And you can always look at the Machoka score. And if the Machoka score is more than 2, it predicts a difficult airway. Please contact a senior anesthetist and prepare for difficulty. Okay. Now, why am I putting this slide? Why is it so important? Remember, in intensive care units, previously what we used to do, whenever there is a patient who needs to be intubated, the people who are on duty, usually they go ahead and try to intubate the patient. They will try. If they are not able to achieve intubation, not able to get the tube in, they bag mask ventilate and then they call for help. Am I right? See, that it may not be possible when you're preparing for a COVID-19 intubation. All of the people who have to be there wearing PPEs already. So once you start trying to intubate, it doesn't make sense if you wait and call for a help, and that particular person, a senior anesthetist, will come after that, and that particular anesthetist will don a PPE after that, and then he'll come in to help you. By the time another 5, 10, 15 minutes it will take. So just imagine the large amount of aerosol which will be generated during the procedure. So you have to be very, very safe. All of you should be ready beforehand. That is very important. And secondly, the most important thing is smallest number of staff. So the smallest number of staff required, just 1 second, just hold on, I'll be there. Sorry. The smallest number of staff, that is very, very, very crucial. So the smallest number of staff, extremely important. So just don't take too many people into the room. So this is a particular COVID-19 intubation setup where I have clearly told you inside and outside. So the intubator is there at the head end. And you can see there is a monitor and airway equipment. Everything is there. And apart from that, you can see that there is a person who is there to take care of the drugs and monitor. A staff nurse will be there, a trained staff nurse will be there. And there is another person who's going to assist you. Probably you are the anesthetist or the intensivist, your junior registrar, your registrar will be there to help you out. And outside, there must be another person parked. So he is there as a runner. So he is going to help you if you need anything else, if you need any other gadgets, any other equipments, or any other thing to help. So that fellow will come in and pitch in. So in some setups, all the people inside the room, they are wearing PPE. The runner need not wear a PPE. For most important point, the runner need not wear a PPE. But suppose if it is a complex ward where everyone who is inside has to be in a PPE. So there are 2 ways you can manage. One, once when you're going into the room, at that time you're wearing the PPE and going. Sometimes the entire complex will have nurses, etc., doctors, etc. in-house, and they will all be wearing PPE when they go into the particular ward. So it doesn't make any difference. But remember, the runner need not wear a PPE. So there has to be 2 different inside-outside areas for intubating these kind of patients. You need that. And this is an important thing which you should do. Use a buddy check for correct PPE fitting. You have to plan, prepare You have to assemble all the airway equipment. Everything should be there. The intubation tray, intubation trolley, viral filters, everything has to be there. And before you enter into the room, you also talk to your team members. You communicate to them what you expect, what is your plan of action, how you're going to go about intubating the COVID-19 patient. That is also very important. PPE, the most important thing, how you're going to don the PPE, that is also very crucial. Then you're going to do the pre-oxygenation, and then you have to perform. So when you're going to perform, that is also very important, how you're going to do it, what technique you're going to choose. All this should be in criteria. And then finally, once you intubate, how we are going to manage a tube after intubation. That is also very important. So these are the various steps, various things through which you have to go. So you have to plan, you have to prepare PPE, pre-oxygenate, perform post-endotracheal AT tube management. That is also crucial. So totally there are six PPEs are there. So totally there are 6 P's are there: planning, preparation, PPE, pre-oxygenation, perform post-endotracheal tube intubation. Okay.